everyone, welcome back to Nursing with Annie YouTube channel. I film content relating to nursing, health, lifestyle to make nursing easy and fun for nursing students and nurses. Yeah, so on today's video, I will be solving question 1 of the May 2022 Nursing Council exams. I'll be solving the number 1 question, and number 1 question was centered on bronchial asthma. So I will be solving the question today. If you're interested in this video, do sit back, relax, and enjoy. Welcome back. I'll be reading out the questions for you to know what the question looked like. And for essay questions in Nursing Council final exams, it's 60 marks. So for each question that comes with brothers and sisters, is 20 marks. Yeah. So number 1 says, Mrs. Akoni, a 25-year-old mother of 1, is admitted into the female medical ward with the history of difficulty in breathing. So we'll be writing out the history, that is the signs and symptoms. It will help us. We'll be writing out the symptoms because I'm sure it will help us. Difficulty in breathing. Difficulty in breathing, wheezy respiration, and cyanosis. Yeah, so these were the symptoms Mrs. Akoni presented. After thorough assessment, a diagnosis of bronchial asthma was made. Now, number 1 says, with the aid of a well-labeled diagram, describe the bronchial tree. So this is a well-labeled diagram of the bronchial tree. When you want to discuss an organ in anatomy, we go with what we call Dr. Luke said she should pay Amanda before leaving North Florida. So this is like the acronym for describing an organ in anatomy. Dr. Luke, the D here stands for the description, the L stands for the location of the organ, the S stands for the size or shape of the organ, the S stands for the size of the organ, the other S for the shape of the organ, and this S here stands for structure, the P stands for the portal circulation, the A stands for the association, organs association, the B stands for blood supply, the L stands for lymph supply, the N stands for nerve supply, and the S stands for function. Sorry, the P here stands for position of the organ. Sorry. Yeah, so that is it. So if you have this acronym in your head or at the back of your mind, you'll be able to describe any organ at all in anatomy. So this is like the sketch. Forgive my drawing. I'm not a good artist. In nursing, you don't try to be a good artist. You just sketch and you label properly to get your mark. So this is like the label. We have the bronchial tree. This is the bronchial tree in form of a tree, the way a tree is with the roots. Then here is the larynx. This is the trachea. This is the left main bronchus. This is the right main bronchus. Then we have the secondary bronchus. We have the secondary bronchi, the tertiary or segmental bronchi, and we have the bifurcation of the trachea. The bifurcation of the trachea is where the division of the right main bronchus and the left main bronchus divides. That point where they divide into two is the bifurcation of the trachea, and that's what we have here. So using this formula, you can be able to describe the bronchial tree. Yeah, you can be able to describe the bronchial tree. Now, the second question, I've said list 4 predisposing factors that has to do with bronchial asthma, and it's already here. We have 1, familial tendency. Anywhere you see familial tendency, it actually means hereditary. So bronchial asthma can be hereditary. Then we have environmental stimuli such as pollen, dust, fumes, insecticides and all that. It can also trigger bronchial asthma. When you hear predisposing factors actually mean what are those things that can trigger a disease? What are those things that can trigger a condition? So yeah, Familial tendency, that is if it is in the gene or if it's hereditary, it can predispose one to bronchial asthma. Environmental stimuli can also predispose one to bronchial asthma, like pollens, fumes, dust, insecticide inhalation, and all that. Emotional stress can also predispose one to bronchial asthma. Fatigue can also predispose one to bronchial asthma, and smoking can also predispose one to bronchial asthma. In bronchial asthma, there is airway obstruction caused by, it's a chronic condition which involves airway obstruction. That is, the person who suffers bronchial asthma will find it difficult to, inhale and exhale air. So there will be airway obstruction in the respiratory tract, and it could lead to, and this could be as a result of bronchospasm, secretion of mucus in the respiratory tract. Yes, so this is primarily what leads to bronchial asthma: airway obstruction caused by bronchospasm, secretion of mucus in the airway. Yeah, so that is basically what bronchial asthma is, and these are the predisposing factors. This is what can trigger asthma, bronchial asthma. Now, the third question has to do with the nursing care plan. They said, develop a nursing care plan to solve 3 nursing diagnoses of Mrs. Akoni within the first 24 hours of admission. Yeah, so we'll be doing that right away. Okay, so yeah, we'll be solving the nursing care plan for bronchial asthma, because like I said, this was the number 1 question of the May 2022 Nursing Council exam. And to solve nursing care plan, you should have in mind that you will be dealing with the signs and symptoms that were presented by the patient, and you should have these 5 points in mind, which is the nursing diagnosis, which is very important, because it is from your diagnosis you'll be able to solve the other 4 components. You should also have the nursing objective in mind. You should have the nursing intervention in mind, the specific rationale, and the evaluation. I think I will do a video particularly for nursing care plan, but for the sake of answering these questions, I might rush through it. Nursing diagnosis: in nursing, the doctors make their diagnosis and the nurses make their diagnosis, and nurses make their diagnosis according to the signs and symptoms a patient presents. So for exam purpose, we have what we call the NANDA list. NANDA list is composed or compiled of all the possible nursing diagnoses with their codes. I will make a whole video on nursing care plan so you understand what I mean. So it has a whole, there are specific diagnoses for specific condition depending on the signs and symptoms the condition comes with. You don't just give any diagnosis here. It has to be in line with the NANDA list, the NANDA classification. So yeah, then we have the nursing objective. Nursing objective entails what will you do concerning this particular diagnosis. What are your intentions? What do you intend to achieve in caring for this patient? That is what the nursing objective is about. Then we have the nursing intervention. What are the things you will put in place to achieve your objective? What are the things you will put in place to achieve your objective? That is what the nursing intervention requires. Then specific rationale is, what is the reason behind the intervention you are carrying out? What is the scientific reason behind what you are carrying out? And then evaluation, this comes after you must have put the intervention, comes when you must have carried out the interventions, and then you are evaluating, you are retrospecting on what you've carried out, if it yielded a positive outcome or a negative outcome. So for bronchial asthma, we have the symptoms the patient presented. We have wheezy respiration, sinuses, and difficulty in breathing. So the number 1 diagnosis we'll have is ineffective airway clearance. Yeah. Let me wipe this off. So ineffective airway clearance. One thing you should do as a nursing student is to master conditions and their peculiar nursing diagnosis that comes with them. For respiration, we have ineffective airway clearance, we have ineffective breathing pattern, we have acute pain, we have disturbed sleep pattern. All those things come under respiration, like respiratory diseases. These diagnoses are similar with them. So the first one I'll be using is ineffective airway clearance. Okay, like I said, evaluation comes after you must have, pondered on the interventions you've carried out. You are going to evaluate or check if what you've carried out as a nurse yielded a positive or a negative outcome. So for my nursing diagnosis as a nurse, you are meant to master the nursing diagnosis that goes with some conditions. Like for respiratory disorders, they have their peculiar nursing diagnosis. For digestive disorders, they have their own peculiar nursing diagnosis, and it goes that way. So the first, for respiratory, we have ineffective airway clearance, we have ineffective breathing pattern, we have acute pain, disturbed sleep pattern. We have a lot of them. So it is left for you to go and master your NANDA classification, and get acquainted with the nursing diagnosis that we have. So if we look at the symptoms this patient presented with, wheezy respiration, sinuses, difficulty in breathing, we have ineffective airway clearance. And ineffective airway clearance, what is the objective? For me, the patient will breathe with ease. We have difficulty in breathing in the signs and symptoms. So you have to, your objective should be centered on the signs and symptoms this patient is presenting with. So difficulty in breathing, the patient will breathe with ease within, let's say, 20 to 30 minutes of nursing intervention. Yeah, so this is my objective, that within 20 to 30 minutes of nursing intervention, the patient should be able to breathe with ease. Now, going to nursing intervention, for the purpose of exam's sake, you should be able to give at least 6 nursing interventions, because when you write 6, you might be correct in maybe 4 of the points you've given. So don't just limit yourself to like 3 or 4. Make sure you write 6, if possible 7, so that when the markers are marking and at the end of the day, maybe there are some you did not get correctly, at least out of that 6 you should be able to get 3 correctly. So the first you should do is assess the patient. Very important. This should always be the first in every of the nursing intervention. Assess the patient. Yeah, you assess the breathing pattern. You assess the color of the skin because of this diagnosis here. You assess the breathing pattern, the color of the skin. The color of the skin, the way the patient is breathing, and all that you assess. Then the second thing you should do is monitor vital signs. Now, when it comes to intervention, we follow Abraham Maslow's hierarchy of needs, and we know that the first hierarchy, or the first step, is what do they call it? Physical needs. Yes, physical needs. And physical needs include air, oxygen, feeding, breathing. So these are the components that should come first before any other thing. So you monitor the vital signs, you check the SpO2, you check the respiration, you count the respiration pulse and all that. Then you position the patient, very important, in a semi-fowler position. Yes, it should be semi-fowler, because this patient is finding it difficult to breathe. So you have to position the patient in a semi-fowler position. Then another thing is you administer oxygen according to doctor's prescription. you administer oxygen according to doctor's prescription. Then you can also give prescribed drugs, that's bronchodilators. Give prescribed drugs. Give prescribed drugs, e.g. bronchodilators. And yeah, like that, it could be up to, I've given 1, 2, 3, 4, 5 because my body is very small. I won't be able to give 6. So I assess the patient, the breathing pattern, the skin color, you monitor vital signs, SpO2, respiration, breathing, then position the patient semi-fowler, administer oxygen according to the doctor's prescription, give prescribed drug, prescribe bronchodilators and all that. So the rationale behind assessing the patient is to get my baseline data. You have to get your baseline data so you could know what you're working with. Monitoring your vital signs also is to get baseline data. Positioning the patient is to make patients comfortable and also prevent. Then you administer O2, for oxygen. Then you give prescribed drugs. What the bronchodilators, what do? They help to, clear the mucus secretion. They help to dilate the bronchi so that air can flow in and flow out easily. So this is for dilatation of the bronchi. Yeah, my body is very small. So evaluation now, you will go back to your objective. Were you able to achieve what you said you will achieve? So when it comes to evaluation, what you will write is patient breathing was normal, within 20 to 30 minutes of nursing intervention and all that. Yeah, so that is that with nursing care plan. This body is so small, I won't be able to do everything, but yeah, you could also do ineffective breathing pattern following this method. You could do acute pain, following this method. It's quite simple. Just get your facts right and you'll be able to solve nursing care plan. But I will still do a video on nursing care plan, basically on nursing care plan. Yeah. The last question that followed the question number 1 was, mention 6 preventive measures towards bronchial asthma. Yeah, bronchial asthma occurs mostly during childhood and it is chronic, and when a disease is chronic, it means it lasts long and it can only take the intervention of God, to take away such disease or disorder. So for bronchial asthma, once it starts in childhood, the person has it till like forever. Yeah, so number 1 is identify and avoid predisposing or precipitating factors. Like I said, one precipitating factors or predisposing factors is environmental irritation, like dust, pollens. You avoid all those things. Then number 2 is take medications when due. Make sure you take your medications when due. This is one way you can prevent asthmatic attack. Then you keep homes dust free. Make sure that homes are dust free. Wherever there is dust, make sure to clean them. Then you encourage clients to be with inhaler at all times. You encourage this client to be with his or her inhaler at all times. Minimize exposure to pulmonary irritants. Yeah. Then encourage deep breathing exercise. Deep breathing exercise also helps when it comes to bronchial asthma. So yeah, these were the questions number 1 carried. These were the brothers and sisters of number 1 question in the May 2022 Nursing Council exam. So I'm done here. In my subsequent videos, I will attend to question number 2 and number 3. I hope this video was helpful. I hope this video was enlightening. If it was and you watched up to this end, give it a thumbs up, give it a like, subscribe to this channel if you're not, so you will not miss out on the educative content I'll be putting out. And I'll see you in my next video. Until then, bye.